Good morning. Thank you all for watching today. This is the Pitt County COVID-19 media session number 10 for April 16th, 2020. We only have one prepared statement today, and that is from Dr. Silvernail with the Public Health Department. And then after that, we will go right into the question and answers. So we'll start with the opening remarks from Dr. Silvernail.
Good morning, Pitt County. I'm happy to report the power at Pitt County Health Department has remained on and we are operating normally. We continue to monitor case counts and continue to see some growth in our total case count number, and I will share those numbers with you this morning. Today makes 2 incubation cycles or 4 weeks since COVID-19 was first identified in our community. I know it feels much longer. Hang in there. You're doing a great job of slowing the transmission of COVID-19. I've been asked to compare this flu season with last flu season and how our social distancing, stay home order has had an effect on that. And I'm going to ask Mike to put a graph up for me here. There we go. All right, if you can see, there's a tall peak of a light gray line. That represents the flu season of 2017-2018, which was a pretty bad season. We had about 11%, somewhere between 10 and 11% influenza-like illness rate, which is as a proxy marker for influenza. The darker gray is last year, a more typical year where we see 5 to 6% influenza. The red line represents this year. And you see, we peaked around the normal time, sort of the midwinter peak that we normally have. And then that rate fell. We started to build a shoulder into that curve. You can see the curve rising again as we get out into late March. And then it dropped off abruptly the last 2 reporting periods. The next report will come out today. These are lagged about 7 days. Agencies report up to a date, and then that date is processed and presented the next week. So the last 2 reporting periods for influenza-like illness or flu has dropped precipitously, and that does correspond to some degree with the social distancing stay-home order that has been in place for Pitt County and much of the rest of the state. Tonight, I'll be participating in a virtual town hall with other local leaders. You may have seen that out there and certainly look forward to that. I'd like to brief you on our case numbers this morning. Across the state, we have 5,465 cases. In Pitt County, we're up to 78 cases. North Carolina, we've had 131 deaths. In Pitt County, we still continue to have only the 1 death that we've reported as laboratory confirmed. Total persons tested, and again, we understand that this underrepresents the total testing in our community is 503. We've had those 78 positive results and 349 negative results. Looking at that on a percentage basis, we're down a little bit under 20% of folks with symptoms who are testing positive. That's 18.3% of folks are testing positive in our county testing data, and 81.7% of people are testing negative. We have 76 results pending at this time that we're aware of. Other public health issues. It is allergy season for many of us, and these symptoms can be difficult to manage for some. I encourage those with seasonal allergies to take steps to manage their allergies and to discuss their symptoms with their personal medical provider if they're having trouble controlling them. Yes, allergy symptoms can mimic or could mimic or be confused with COVID-19 symptoms. Most people with allergies, longstanding allergies, know their symptoms and their triggers, but if you're unsure of the cause of your symptoms, please consult your personal medical provider. Also, I'd like to remind you to remember that our health education staff continue to man our dedicated coronavirus hotline, COVID-19 hotline. If you have COVID-19 questions, please call the main health department number, which is 252-902-2300. And finally, please go home and stay home. Thank you.
Okay, before we go into our question and answer segment, I do want to open the floor for any of our other community or municipal partners that may be on the line that that may have any prepared statements that I wasn't aware of. I believe we have Pitt Community College, the Pitt Greenville Airport, and a couple of others. I'll open the floor now. Any other prepared statements? Okay, well, we'll get right into our question and answer. We'll start with Dr. Silvernail, and then we also have Brian Floyd with Vidant Health here, along with county management and emergency management representatives. We'll start the questions with Dr. Silvernail, and I believe the first to log in was WNCT, Ariana Kraft. If you would like to go ahead and start with your questions as Dr. Silvernail is coming up.
Hello?
Hi, good morning. So with people now having a lot of cabin fever, what would you like to say to people who are ready to get back to work? They want to start getting the economy going. And, we're seeing more protests of people wanting to stop with the stay-at-home order. What would you say from your perspective on that issue?
I would say hang in there. While we made recommendations to our political leaders, that remains a decision with our political leaders and with the governor. I believe the governor's convening a task force to look at those issues. We'll continue to provide data and opinion to our political leadership as they request it. I know it's frustrating. I think we're all a little tired of being at home. There's only so much TV that you can watch or books that you can read at one time. But I do think we need to hang in there a little bit longer.
And when we talk about going back to normal, clearly, I don't think things will go completely back to what we were used to. So what practices from your perspective do you think that we'll continue to see after the economy does open up, we are able to go outside more, but what practices do you think that we'll hold on to?
Mhm. I think we'll need to still maintain that idea of social distancing and not be as touchy or huggy a society as we were, at least in the short term. Handshakes will probably still be a thing of the past for a while. The masks, I think some people for comfort are going to continue to wear masks. Ultimately, if we get to the point where there's enough herd immunity, those things can go away. If we get to the point where we have a vaccine and we can get a reasonable number of folks vaccinated who can and should be vaccinated, I think that'll help. We do understand there are some folks who legitimately shouldn't be vaccinated, and we don't want to vaccinate folks for whom it might be medically inappropriate. But otherwise, we certainly would like to see the vaccine, when it's available, be taken up widely in our community.
Certainly. And when you talk about herd immunization, what about immunity certificates? Is that something that you foresee in the future?
I don't know if we would provide those, or we may provide a proof of vaccination. I don't know if we could provide proof of immunity. Sometimes even folks who have a measurable antibody titer can, in rare occasions, be subject to reinfection with a given disease.
Awesome. Thank you so much.
You're welcome.
Okay, moving on. Tyler Harden, WCTI. Proceed with your questions.
Yes, good morning, Dr. Silvernail. I just wanted to ask a quick question about some of the testing. I see that obviously it's kind of changed as far as, we have 81.7% returning negative and the 20% returning positive. And I know that for a lot of the testing, people have to meet that certain criteria. So I guess, what does that mean? Is that something you all expected for the results to be like that? Or can you shine a little bit of light on why the results are 80 versus even more or less?
I think they're running about where they've been, Tyler. We had, depending on the day, there was one day where our positives had actually crept a little above 20%, but then it quickly went down. Some of that depends on how fast we get negative results back, because the size of the denominator has a big effect on this. Would like to think that if we're starting to see a decrease in the number of positives, that represents decreased transmission in the community, but that may be more wishful thinking than anything. but roughly still, we're 4 out of 5 people tested with symptoms are testing negative. So I think that's a good thing for the community. And only about 1 person in 5 that has symptoms consistent with COVID is testing positive. So I also think that's a good thing for the community.
Most definitely. And are the people who are still getting those tests now, do they still have to get the influenza test and meet all of those certain criteria before they could get the COVID-19 test?
No, the requirement for influenza or other virus testing has been dropped. Now, at a provider's discretion, if the provider thought that another infection was more likely, a provider certainly could test for other things before proceeding with a COVID-19 test, but those things are no longer required.
Certainly. And I know that you mentioned the flu or influenza earlier in your statement. Do you know how many positive, I guess, flu tests have we had in the same time that we've been testing for COVID-19 too?
In Pitt County or in the nation or?
In Pitt County.
I don't have a number for Pitt County, Tyler. I know across the nation for this flu season, the CDC estimates that there were 32 million cases of influenza in the US alone this year. There were approximately 310,000 hospitalizations from influenza. And in the influenza death data, there were 18,000 influenza-related deaths. 125 of those were children.
And as far as going back to some of your statement that you had last week, I know you mentioned, the opioid epidemic. I guess since we've had these stay-at-home orders and people have been staying in place, has that become more of a bigger problem than in years past?
Well, I think, anytime that people are under stress, they're potentially more likely to use or abuse substances. We wanted to mention that to folks in my remarks on Tuesday. And we also, we have a program at the health department to provide the naloxone or Narcan rescue kits to people at no charge. And we wanted to get that into our messaging and let folks know that that was available. And sometimes it's not even folks who abuse drugs. Sometimes it's folks who have been prescribed opioids for pain control, that if they're not used to those medications can unintentionally overdose. So it's important that class of medicines be respected, both for the good things it can do, but also for the harm that they can cause.
Certainly. Do you all have any kind of numbers as far as like admissions or any numbers kind of relating to the opioid epidemic just since, the stay-at-home orders have been in place?
No, I'll be honest, Tyler, we haven't looked at that to see if we've seen any change in that. Randy Gentry's here. I don't know if Randy's seen anything from an EMS dispatch. I'm getting a no shake from Randy. I think there's a certain amount of that our EMS system deals with on a day-to-day basis. Mr. Gentry doesn't seem to indicate that that's any different at this time.
Okay. And just to wrap things up, I know that some states and other municipalities have, implemented, if you leave the house, you are required to wear a mask. I know for New York, they've done that. What are your thoughts on that? And do you see that, with kind of how everything's developing as a possibility for something here in North Carolina?
That may become part of the reopening strategy. Personally, I'd rather see that as a voluntary thing, with the idea that if you're sick, that you should put a mask on to protect other people. But for you, in terms of protecting yourself, I think that should still be optional.
All right, Dr. Silvernail, thank you for your time. I appreciate it.
You're welcome.
Okay, next up for questions, we have Deborah with the Daily Reflector. Feel free to go over with your questions for Dr. Silvernail. Daily Reflector, Deborah Griffin, if you're on the line, any questions? Okay, moving on, we'll open the floor for questions if there are any questions for Vidant. We'll start with Ariana with WNCT. Do you have any questions for Vidant?
No, thank you.
Okay, Tyler, WCTI, do you have any questions for Vidant Health?
Yes.
Okay. Please go ahead with your questions.
All right. Yes, good morning. based off of the comments from Tuesday, I just was curious to see kind of what the number of completed tests you all have ran as far as using your rapid testing system.
Well, thank you for the question. I don't know the exact number of testing. That's something that we're doing moment to moment. I will say that we currently have 40 patients hospitalized in Vidant Health with COVID. We have seen an increasing amount of testing capability, which is allowing us to test more patients than we were before. And today, for instance, we received reagents to do 1,000 tests for the course of the week. So certainly a great increase in our capability of testing. And we'll start to do that beginning with patients, obviously, that are the sickest, who need ICU care, those that come into the emergency department that are very sick and we want to rule out or test them positive. And then we'll be moving into the categories of where people who need procedures that have been delayed, we will start to test them so that we can set up their procedures.
Okay. And then, so yeah, as far as, I know earlier you mentioned too, looking at the possibility of starting those elective surgeries. Have y'all made any progress on that or any decisions on that front?
We're still evaluating that. As I mentioned, our hospitalization number is still going up. And what we want to make sure of that when we begin to do elective work, we want to make sure we're seeing a plateau or preferably even the backside of the curve. We're not quite there yet. And the process with which we re-engage in that kind of work is something that we have to work with our physicians to understand the priority of those patients. And right now, the work we're doing is planning for the priorities to make sure we take the most urgent of cases first, that we have a mechanism with which to test those patients prior to the surgery so that we can rule out any COVID positive patients during that process. And then that has to be done, of course, around our region. So we're still working with our physicians on gaining an understanding of which kind of cases we need to go first.
Gotcha. And just to kind of wrap up, I know that number of how many patients you have in the Vidant Health system is changing rapidly. I didn't know, have you all had a COVID-19 case in every single one of your hospitals so far, or are you still seeing hospitals that have had no COVID-19 patients?
I don't believe any of our hospitals haven't had a COVID patient. Now, some of those patients may have gone to an emergency department, tested positive. We moved them to another hospital, perhaps. But the exposure to COVID-19, I believe, has been experienced in all of our hospitals now.
Okay. All right. Thank you for your time.
Okay. And we'll try once again with the Daily Reflector. If you are still in line, are there any questions for Vidant?
No, thank you.
Okay. Thanks. Okay, we'll open the floor for any questions for any other of our municipal or community partners that are here now. Again, reminding you, we have county management, emergency management, and some of our other partners that are joined us virtually as well. So we'll go through the list for any additional questions real quickly. WNCT, any additional questions for any other partners?
I have a quick question for Mr. Hopper with PGV. Now, I just think that, people are probably wondering about travel still. From your perspective, what do you have any recommendations on if people are flights or
Bill Hopper with PGV, if you were on the line, did you hear that question?
Could you repeat the question?
Sure. So with travel, well, first of all, are you seeing, what are you seeing from your perspective at the airport with travel? How has that impacted you guys?
It's impacted us greatly. Our passenger numbers are down just like the rest of the country, over 93%. Hold on just a second. I'm getting a little bit of double here. Sorry, I had two sound systems going. Anyways, no, we've been affected tremendously. We're seeing our passenger numbers down 93%, just like they are around the rest of the country. We are right now are having about 2 turns, two departures, 2 arrivals a day, which compared to 5 is what we have always been here. So there's been a lot of effect. Bottom line is, the passenger numbers have gone down tremendously.
And with people, I don't know if people have flights purchased further into the summertime. Is there any recommendations you have if people have flights for, later on, what they should do?
I would say get a hold of your airline and have get your recommendations, and of course just the social distancing that has been recommended as well. But ultimately, I think you need to contact your airline and go by their recommendations.
Thank you very much.
Mm-hmm.
And while we're on you, Ariana, did you have any questions for any of the other partner agencies?
No, thank you.
Okay, moving on, Tyler Hardin, WCTI. Do you have any questions for any other agencies here?
Hi, Mike. Is Greenville, the city of Greenville, on the line or no?
I do not think they're on this.
I'm here.
Oh, sorry. My apologies, Brock. Yes.
Okay, perfect. Hi, Brock. Good morning. I wanted to just follow up on the employee that was tested positive for COVID-19 with the transit system. Have y'all taken any other steps, or have any other employees within the city, have they tested positive for that as well?
We have not had any other employees test positive. As far as any other steps we've taken, aside from what we had provided to you guys 2 days ago, reducing the number of routes, eliminating fares, and unloading and loading from the back of buses to limit interaction between drivers and riders, the cleaning of buses, signage on the buses, and then the supplying of personal protective equipment for drivers. The only additional step that we've taken is our full-time drivers were all sent home for the remainder of this week just to self-monitor. None were showing symptoms, but we thought it'd be a good idea for the remainder, some of our part-time crew to fill in with those routes. That's the only additional step we've taken aside from just continuing with what we've been doing since around mid-March.
And as far as your ridership, ever since the stay-at-home order and everything, since that started, what do those numbers look like? Have those fell off, or have they increased since you've had the free fare?
Yeah, I'm told our ridership is down about 50% overall.
Okay, thank you.
Welcome.
Okay, and Tyler, while we're still on you, any other questions for any of the other agencies?
Mike, I think I'm good. Thank you.
Okay, finally, Daily Reflector. Deborah, do you have any questions for any of the other agencies here?
No, thank you.
All right. We did have a Pitt County Commissioner on, Mary Perkins Williams. Commissioner, do you have any questions for any of the agencies present?
No, I've only received one question that I had no answer for, and I could not call in. I was so busy. About schools, I know they're on break this week. Do you have any idea if they're going to reopen before the year is out, or what, or do we not know?
It looks like we do have Jennifer Johnson, Public Information Officer for Pitt County Schools, on the call. Jennifer, are you able to answer that question?
Yes, I'm here. We do not have an answer for that at this point. We're waiting for any guidance from the governor on that, but no, we don't have any information regarding closure beyond May 15th.
Thank you.
You're welcome.
Okay, well, that concludes this media session for today. Thank you all for watching. I do, once again, as always, want to encourage everyone to visit the Pitt County coronavirus information page of our website at www.pittcountync.gov/coronavirus. Also, for information purposes, we have the hotline, which can be reached by calling the Public Health Department at 252-902-2300. And also, questions can be submitted online at pittcountync.gov/COVID-info. Our next media session will be media session number 11, and that will be on Tuesday, April the 21st. Thank you all for coming. almost did.